Hydralazine Hcl is a medication used to treat high blood pressure. It can be taken alone or with other medications. Lowering high blood pressure is important for preventing strokes, heart attacks, and kidney problems. Hydralazine Hcl is a vasodilator, which means it relaxes blood vessels to make it easier for blood to flow through the body. It is usually taken 2 to 4 times a day, and the best time to take it is typically before meals. It is important to follow the dosage instructions provided by your doctor and to not miss any doses. When taking Hydralazine Hcl, it's important to follow your doctor's instructions. Typically, you'll take this medication 2 to 4 times a day, with or without food. Your doctor will start you on a low dose and may gradually increase it based on your response to treatment. It's important to take this medication regularly at the same times each day to get the most benefit from it. Even if you start to feel better, continue taking it as prescribed. It may take a few weeks before you notice the full benefit of the medication. It's crucial not to stop taking Hydralazine Hcl without consulting your doctor, as some conditions may worsen if the drug is suddenly stopped. If you experience any worsening of your condition, such as an increase in blood pressure readings, be sure to inform your doctor. As with any medication, there are potential side effects to be aware of when taking Hydralazine Hcl. Some common side effects include headache, fast heartbeat, loss of appetite, nausea, vomiting, diarrhea, and dizziness. If these effects persist or worsen, it's important to notify your doctor or pharmacist. To minimize the risk of dizziness, it's advised to rise slowly from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, there is a rare possibility of nerve problems arising from taking this medication. If you experience numbness or tingling, it's important to notify your doctor, who may recommend a vitamin B6 supplement. Serious side effects that should be reported to your doctor immediately include severe tiredness, joint pain or swelling, rash on the nose and cheeks, swollen glands, signs of kidney problems, signs of infection, easy bruising or bleeding, and chest, jaw, or left arm pain. Additionally, seek medical help right away if you experience symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a comprehensive list of possible side effects, and if you notice any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking hydralazine, make sure to inform your doctor if you have any allergies or if you are allergic to this medication. It's important to know that this product may contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. Before using hydralazine, be sure to tell your doctor about your medical history, especially if you have heart problems, blood vessel problems, a history of stroke, or kidney problems. It's important to note that hydralazine may cause dizziness, and consuming alcohol or marijuana can increase this effect. Therefore, it is recommended not to drive, use machinery, or do anything that requires alertness until you can do it safely. It's also essential to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are planning to have surgery, it's crucial to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, it's important to be aware that they may be more sensitive to the side effects of hydralazine, especially dizziness, which can increase the risk of falls. If you are pregnant, hydralazine should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. For breastfeeding mothers, hydralazine passes into breast milk but is unlikely to harm a nursing infant. However, it's crucial to consult your doctor before breastfeeding. Drug interactions can affect how your medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not change the dosage of any medicines without your doctor's approval. Some products that may interact with hydralazine HCl include MAO inhibitors such as isocarboxazide, linezolid, and selegiline. It's also important to be cautious with products that could raise your heart rate or blood pressure, such as cough and cold products, diet aids, and NSAIDs like ibuprofen and naproxen. When taking hydralazine HCl, it's important to discuss any potential interactions with your doctor and pharmacist to ensure safe usage. Always follow their recommendations and ask about the best timing and dosage for your specific needs. If someone has taken too much hydralazine HCl and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe dizziness, fainting, flushing, chest/jaw/left arm pain, and irregular heartbeat. It's important not to share this medication with others. In addition to taking this medication, making lifestyle changes such as participating in stress reduction programs, exercising, and adjusting your diet may help it work better. Be sure to talk to your doctor or pharmacist about lifestyle changes that could benefit you. Your doctor may want to perform lab and/or medical tests, such as a complete blood count, while you are taking this medication. Be sure to keep all medical and lab appointments, and consult your doctor for more details. It's also important to have your blood pressure checked regularly while taking this medication. Your doctor can teach you how to monitor your own blood pressure, and it's important to share the readings with them. If you forget to take your dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. Make sure to store hydralazine HCl at room temperature, away from light and moisture. It's important to keep this medication out of reach of children and pets, so make sure to store it in a safe place. When it's time to dispose of the medication, don't flush it down the toilet or pour it down the drain unless instructed to do so. Instead, consult your pharmacist or local waste disposal company for proper disposal instructions. And remember to discard this product and it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.